All right, welcome back, everybody. It's 11 o'clock, so we're going to go ahead and get started. I would like to introduce Annie Rosenthal from the Chautauqua County Department of Mental Hygiene, and she is the coordinator for all the media efforts in Chautauqua County. So welcome, Annie. She's going to introduce our next speaker.
Good morning, everyone. Thank you for attending today. I have the pleasure today to introduce my friend and colleague, Victoria Eckert. Victoria Eckert has worked for the Chautauqua County Department of Mental Hygiene for 10 years in various roles, but currently serves as the Community Engagement Coordinator and Training Specialist for the department. And she is also the Project Director for the Chautauqua Tapestry Expansion Initiative. Victoria has her Master of Science in Social Administration and Children, Youth, and Family Social Work degree from the Mandel School of Applied Social Sciences at Case Western Reserve University in Cleveland, Ohio, and is a licensed social worker in New York State. Victoria is also the coordinator for the Community Alliance for Suicide Prevention in Chautauqua County and teaches various college courses at SUNY Fredonia. Let's welcome Victoria this morning as she presents the suicide prevention training, Talk Saves Lives.
Great. Thank you so much, Mel and Annie, for that introduction. I'm truly honored to have been given the opportunity this morning to talk about this very important training that not only means a lot to me personally, but I feel can really help our community have a better understanding of general suicide prevention and how anyone in our community can lend a hand at someone when they are struggling. So today, just a little bit of background information. I am going to be giving a lot of information, so there may not be a lot of room for questions at the end, but please share those questions to the panelists and we will try to get them answered in some fashion throughout the day. My contact information will be on the last slide for you to email me some general questions. You can also feel free to reach out to me in the chat after the training and we can talk about any of the questions that you may have. This training is typically about an hour that I'm going to try to get through in about 45 minutes. It is a evidence-based curriculum through the American Foundation for Suicide Prevention, which we partner heavily with. They are the leading researcher in the country around suicide prevention. AFSP provides us in Chautauqua County with quite a few different programs, resources. We also partner with them for our Out of the Darkness Walk and our International Survivors of Suicide Lost Day. So to start, I would like to just mention that obviously, you know, we are talking about suicide, and that can be a very difficult topic for some people, whether that's from personal thoughts and feelings, maybe you've lost someone, maybe you've had some, times in your life where suicide has touched you in some manner. And please, if you are finding yourself to be in any sort of emotional need after this discussion today, please reach out to me directly, and I would love to talk with you more about that. So to start, Talk Saves Lives is considered to be an introduction to suicide prevention. It's also a gatekeeper training, which really means that part of our initiatives through the Department of Mental Hygiene and through the Community Alliance for Suicide Prevention, we go out into the community, have conversations with stakeholders, community groups, community members, parents, young people, everyone that you can think of around the importance of talking about mental health and suicide specifically. We know through research and just general way of life that taboo is one of those, or suicide is one of those taboo subjects. And so whether that the information that maybe we've grown up with throughout our life, maybe the way that we have heard of people who may be considering suicide or die by suicide. And I hope that today some of this information helps combat some of those stigmas and gives everyone on the talk some skills and resources and knowledge on knowing that they can do something to help prevent suicide in Chautauqua County and the Western New York region. Okay. to start, we know, we're here for hope and healing. We're here to talk about all sorts of things around substance use, addiction, mental health. We're talking about suicide in this workshop, and everything that we're talking about today is a public health issue. So what does that mean? That means that at any time, suicide in Chautauqua County, in our region, the state, the world, it can affect anyone at any time. A lot of times we have these ideas that it's only certain groups of people at certain points in their life when they've had some extreme hardships or emotional difficulties, and that's untrue. As we go through this training, while those can be risk factors, hopefully we can point out some of the factors, the complex factors in which people may consider suicide, but what importantly we can do to help prevent suicide as community members. So the most important message I want everyone to leave here today with is that suicide can be prevented. Many times we have this idea that when someone gets the idea of suicide in their mind, if they've come to that roadblock in their life where maybe they don't have a lot of hope and healing and protective factors present in their life, and suicide may be a consideration, that does not mean that that person necessarily will follow through with their thoughts. And we also need to recognize that we at any time can help someone stay safe, and it can always be prevented. The best way to prevent suicide is to be comfortable with asking about suicide. And I think that's one of the most important pieces that I find with talking to community members is that we've learned that if we are comfortable, genuine, and direct with asking someone about their thoughts of suicide, not only does that show someone that we are paying attention to maybe their emotional differences or behaviors that might be a little bit changing due to, whether it's an undiagnosed mental health condition, perhaps an addiction, perhaps it could be life circumstances. If we ask about suicide and we're confident in the way we ask and we're open and direct and honest, that's the best way to prevent suicide. And of course, knowing who the resources are to get someone in touch with to keep that person safe. We also know that just like there are warning signs and risk factors for other health crises, like things like cardiac arrest, we can learn the warning signs and risk factors that help us prevent people from dying by suicide, which we'll go through some of those today. As with other health issues, it's important to know that prevention can start early. So it doesn't have to be at the point where someone has reached a crisis situation. If we start noticing those little differences in someone's behavior, the way that they're talking, so maybe the way that they're coping with some life circumstances, it's time to ask questions and not be afraid to address those things. I think sometimes we get this idea that it's not my business, or I don't want to pry too much, or I don't want to bother, I don't want to burden this person with talking about what's going on with them. But I think the more that we feel comfortable in opening that door of communication, people who may be at risk for suicide have a feeling that someone is paying attention to them, noticing them, and feels comfortable in getting them help and support. It's also important to know that if you're not in the mental health field or in the health field in general, such as like a nurse or a doctor, every single person on this call in the community can help prevent suicide. Whether that's from talking to someone about this training today and trying to help mitigate some of those taboos that we've learned, that's helpful. It's also helpful to share our local mobile crisis hotline number, the national number, even sharing some hopeful messages on social media, and also realizing the skills and the resources that we have locally to keep someone safe. So we're going to go through a little bit about each of these. We'll talk about the scope of the problem. So of course, I'll give you some statistics. We'll talk about why research is so important when it comes to suicide prevention and intervention. We'll also talk about what prevention looks like and what you can do. And I know I highlighted that a little bit, but I think it's important that we make sure everyone leaves today prepared with the skills that will help you feel more confident in having some of these conversations. So how we talk about suicide matters. Language is so important. So we really want to pay attention to that terminology that we use to speak about suicide. And it might seem like, especially if you're in the field, you feel comfortable in talking about some of these things, but it's really important that just knowing in the way that we discuss mental health, of course, and suicide can have a profounding impact on how someone interprets your thoughts, feelings, and perceptions.
Yeah, I mean, we have a backup.
So moving forward, so we're looking at some language do's and don'ts on this chart right here. On the left are things to avoid, and on the right are things to say. So, I know for years we have said things like committed suicide or a failed or a successful suicide attempt. And research has shown that obviously while those are not hopeful terms, we want to be more, more caring in the way that we talk about things like this because, we only know this much of someone's story. We don't know their experiences with suicide, whether that's personal thoughts or someone close to them. We also don't know how someone perceives suicide, whether that's from cultural backgrounds, religious backgrounds. And so if we can say things like died by suicide, they have ended their life or they've killed themselves, not only is it more accurate, but it is not implying judgment on the person as if they're committing a crime or a sin. Also suicide attempt or death by suicide, because if you're looking at the left, if we're categorizing a failed suicide attempt, that is a death by suicide. And a successful attempt, I think we just need to be more mindful of the way that we're speaking. I do other trainings such as mental health first aid, and I usually talk a little bit about how, even being careful around the way that we speak about mental illness. I often give the example of we speak about the weather. I hear a lot of people saying that the weather is bipolar. And so obviously, you may be speaking with someone that has a very close family member that is struggling with bipolar disorder. And inadvertently, we may give that person the impression that we're being judgmental or we're talking about the weather in a very serious term that really can be debilitating for some. Okay, excuse me. Moving forward. So here's some of the scope of the problem I had mentioned before, some of those numbers. And I know probably many of you on the call are numbers people, and it's important that, while we know that suicide is a leading cause of death, we put that into perspective for you as well. So we know through research that the American Foundation for Suicide Prevention does globally, we know that over 800,000 people die by suicide each year. While this is the most accurate data available, we estimate these numbers to be much higher in reality. Suicide often is underreported in many countries, which doesn't give us a clear depiction of the accurate number of people who die by suicide globally per year. If you break that down, someone dies by suicide every 40 seconds. And in the US, suicide is the 10th leading cause of death. So you can see on the bottom here, in 2017, a little over 47,000 people have died by suicide. Suicide takes more lives in the United States than homicide, war, and natural disasters combined. And the numbers here are high for a variety of reasons, but it's the most important thing that we would like to make sure everyone knows today is that the importance of talking about suicide, like any other cause of death, will create a society that is less stigmatized, and it can help people who face the struggles around suicide and their mental health needs and have that positivity and confidence in reaching out to resources to stay safe. We also know that for every one death by suicide, 25 others attempt. And so, sometimes it's hard to understand the fact that suicide is so complex. I think a lot of times we, especially someone who is a survivor of suicide loss, tries to make sense of why someone has taken their life. And And sometimes we don't know the whole story. Again, I had mentioned before that we only know this much of someone's life. We may not know a history of trauma, or a history of abuse, a history of toxic stress even, and how someone interprets that and copes with that. So just because on the outside we may see a happy person doesn't necessarily mean that's what's going on the inside. We also know that when you think about any loss, it impacts many people in our community. Suicide is no different. The loss affects family, friends, coworkers, neighbors, schools, faith communities, and the list goes on. It is estimated that the majority of Americans will experience a loss of suicide over the course of their lifetime. So that really rings true to me, that this training is more important than ever. Opening that door, creating a culture that it's safe to talk about suicide, and giving the people, any people, confidence in having some of these discussions. You know, we also know that a lot of times when people are struggling with their mental health and their emotions, it can sometimes be very difficult to reach out for help. Well, we know that treatment is very important. It can be a difficult thing to do. And if we're giving the skills to any community members in our general area and the state, I think that we'll be better equipped to recognizing when people are struggling before it turns into a crisis situation or a death. We also know that through research, suicide has an economic impact. Well, that's hard to think of when we're talking about lives. We know that $69 billion per year in the United States is lost due to suicide attempts and deaths, primarily because of lost wages and productivity from the toll that a death by suicide or an attempt can have on individuals. So we're going to look a little bit on research here. So only in the past several decades have scientists been studying suicide. So it's relatively new to research. Although it's new, it has been shedding light on many critical areas. You know, we look at things like what drives up risk, what amounts to effective suicide prevention, but we do know that we still have more to learn, not only locally, but nationally and globally. So we're going to look a little bit about different research and how that affects this work. So starting with one of the main questions that everyone has is, why do people take their own lives? I'd mentioned this a couple of times in the beginning of the talk, that there is no one single cause. We can't, look at someone who has attempted suicide or has died by suicide and say, I know it's because of this reason particularly. It's so complicated, and there are multiple intersecting factors that can affect someone's risk factors and resilience level around some of these. We do know that the large majority of people who die by suicide have a mental health condition contributing to their death. So whether that was an underlying condition that was not diagnosed, it could be a condition that was not being properly treated. And we also know that many community members who may be struggling with mental health sometimes use substances to cope with some of those symptoms, and that can also be a risk factor in suicidal ideation as well. 1 in 4 people will experience a mental health condition, but most do not go on to die by suicide. So we do know through research that there are some physical differences. The brains of people who die by suicide differ from those who die from other causes in both structure and in function. So we're looking at things like areas that are related to stress response and impulse control. When I do this talk in person, I give some more in-depth examples around if myself and, if I had a brother, if we experienced the same exact thing in life, whether it was a natural disaster or perhaps the COVID-19 pandemic, we'll say, I think that's relevant for everyone. I may experience that much differently than my brother, even though we may have been raised the same in the same household, have similar beliefs. I may have maybe poor coping skills. I may not have anyone to turn to talk, to rely on. I may not feel in tune with my thoughts, emotions, and behaviors to realize when I am having difficulty. But maybe his resiliency is much more strong and he has a lot of protective factors. So it's all individual, I think is what I'm trying to say. We all experience stressors and life experiences differently for a variety of complicated reasons. Most people who are suicidal are ambivalent about taking their life. What does that mean? That means that part of them wants to live and part of them wants to die. And what happens is that when someone is feeling helpless or hopeless, they may not see any circumstances in which they'll feel better from their symptoms, which they'll move on from whatever life circumstances becoming troubling for them. They may have experienced some sort of trauma in their life that they're having a hard time coping with. They may find that the thought of suicide is their only option. But as humans, we have this push to live and stay alive and push forward. So there's this ambivalence that exists there. And as community members, or anyone really who is talking to someone who's struggling, it's important to know of talking with someone about their ambivalence and putting time and space in between their thoughts of suicide and the action of suicide is the best life-saving measure. I had mentioned before that the perspective of a suicidal, it's when that crisis point has been reached. They are extremely desperate to escape pain. Whether that is sometimes mental health difficulties can create intense physical pain that people have a very hard time dealing with. And their thinking becomes limited. So again, I had mentioned before about impulse control. Maybe rash decisions are made. Their thinking becomes limited in the way that they're in that sort of survival mode, that fight or freeze mode. And it's hard to think clearly during this time and to know how maybe prioritize on how to reach out for support, how to even let someone know that you're struggling. It can become a challenge. So having patience and understanding for that perspective as well is important. So who is at risk? I think that while there's a lot of research done on who's at risk, it's important to note here that we can't get almost tunnel visioned within that research because we know that some cultural groups and backgrounds have maybe perhaps a greater risk to suicide, whether that's because of suicide experience, which we'll talk about shortly, whether it might be just life circumstances in general. We can't get sort of blind to the fact that anyone in our community can struggle with thoughts of suicide at any time, because if we only put people and pay attention to those at-risk groups, we may miss someone that is clearly struggling that doesn't yet fit into one of those groups in our minds. So we want to be very open to the fact that anyone can struggle at any time for any reason. So moving on to risk factors. Risk factors are defined as characteristics or conditions that increase a person's chance of taking their life. So we're looking here on this chart, it's a combination of health, historical, and environmental, and you can see that they're intersecting in a variety of ways. We'll go through each of those as we go on. So health factors, I have talked about mental health conditions. These are some of the most common here. I'm sure many of you on the call know about these. We're looking at a lot of biological and psychological medical conditions. But these, I think, are very important because I had mentioned before, the stigma of reaching out for help can be difficult sometimes. It can be difficult to admit that you're struggling, that you need support, that you need help. Of course, we're looking at all sorts of circumstances of why that may or may not be accepted in families, and being sensitive to that and understanding. We also know that most people who die by suicide have an active mental health problem at the time of their death. Depression is the most common mental health condition and is the one that is most associated with suicide. While bipolar disorder is also shown to be high risk, the disorder is less common than depression. Because these conditions put a person at greater risk of suicide, detecting the presence of a mental health condition is critically important. So picking up on those small behavioral and emotional changes in someone that's close to you can be life-saving if we have the courage to have those conversations. And the best way to be sure is when you feel concerned or detect a difference in that person is not only to have a conversation, but to encourage that person to reach out for a professional evaluation and whatever effective treatment makes sense for that person. And of course, treatment looks different for everyone as well. And of course, recognizing that someone may not realize that their distress has become a health problem. And it's perfectly acceptable to reach out for support, just like it would be if you broke your leg or your arm or something like that. So I think if we can try to create that culture that we look at mental health, reaching out for supports and resources and treatment like we do physical health, that will hopefully lessen some of that stigma. So moving on to other health factors, we're looking at things like serious or chronic health conditions that can increase risk, especially when the person has combined mental health issues. Chronic pain and serious head injuries have also found to increase suicide risk as well. Historical family factors, I had mentioned before, experience of suicide is what I had called it. And that really means if they themselves have had a family history of suicide or mental health conditions, if they've had any experience with childhood abuse and or previous suicide attempts. So the more experience someone has with suicide, the higher risk they may have, but is not always the case. And then lastly, environmental factors. So access to lethal means, right here, these are the aspects that can contribute to their overall level of risk. Having access of ways to take one's life is referred to as access to lethal means. So it's important that if we are very worried about someone who is actively having thoughts of suicide, we want to make sure that we are not leaving that person alone, especially with any access to lethal means in their immediate surroundings. Putting that time in between their thoughts of suicide and separating them from access to lethal means can prevent suicide and can save lives. As far as contagion, this is the exposure to another person's suicide or to graphic or sensationalized accounts of suicide. Especially among those who with other risk factors can increase a person's risk. That's why it's very important that, as far as reporting or things like that, we make sure that those media reports and things like that, they don't have to be sensationalized. Same thing with TV shows, things on social media. So be very aware of the things that you're posting on and how that can affect others, when really the intention is probably positive on your part, but just having that awareness, I think, is important as well. I mentioned toxic stress and prolonged stress a couple of times. So that's things like harassment, bullying, relationship problems, legal problems, or unemployment. And then stressful life events, which can vary across the lifespan. I mean, I think sometimes life can be stressful, but knowing what makes sense for you and how you cope with that stress, who you reach out to for support and help, it can be very important in dealing with some of those stressors in everyday life. So if we see here what others see, we're looking at on the outside, someone who may be sad, brokenhearted, but the things we may not know. So again, not knowing that person's whole story. Where is their genetic risk? What are those experiences with suicide in their life? The history of family suicide. Is depression present? Again, depression is not always obvious. So realizing that someone may not seem depressed to you, but we don't know sometimes someone's full story. Again, that toxic stress, and then substance use, maybe to feel better or to cope with life circumstances or symptoms. So understanding when those behaviors are changing and how someone may be coping with something. So the importance of research here, these are the best ways that we have to learn more on how to fight suicide. Research is looking for biomarkers, so example testing something in a blood sample that can help us identify those at risk. There's been a number of clinical treatment, like particular types of therapy that are effective for suicidal people, and more need to be developed and studied. But the good news is, though, that through research, we are learning more and more about what helps those who are in a suicidal crisis. And as well, research can help us identify the most effective interventions to reduce suicide rates and to reduce risk in those who have prolonged mental health conditions. So moving on to prevention, we have some protective factors here. We're looking at mental health care access and availability. Family and community support is so important, and opening those doors to having those important conversations with our families and those close to us, and coworkers and anyone is so important. Having that confidence to do so. Problem-solving skills are so important. Being able to work through, those day-to-day life issues, recognize when we need extra help and support, and when to know when to reach out. And then cultural and religious beliefs can also be very protective in keeping someone safe from their thoughts of suicide. Mental health care is an important ingredient for preventing suicide. We are going to focus on that for a couple of minutes. Getting effective treatment for mental health conditions such as anxiety, depression can help prevent suicides. The problem is that only 2 in 5 people with a mental health condition actually seek treatment. We know a culture where everyone knows, we need a culture where everyone knows to be smart about mental health. So again, looking at mental health, just like you would your physical health, taking care of our body is so important. Having a good diet, getting enough sleep, becoming hydrated, things like that. And I think if we exercise our brain and realize that our brain can get sick too, and when to realize of when to when that you're not feeling well, and to reach out for extra help, just like you would going to a primary care physician. So being proactive about mental health, making your mental health a priority, recognizing those signs when you feel as if you are extremely stressed and what that toxic stress looks like, identifying that early and working on solutions to fix that. You could do things such as seeing a doctor or a mental health professional to get further advice, get an evaluation perhaps, discussing treatment options. Again, treatment doesn't always look the same for all people, so it's important to find what works for you. And again, it's all in perception. So it's important that we are finding out what's available, which we have a lot of resources in Chautauqua County. I think we're very lucky. I have traveled around the country and into different conferences, and I think that we're very lucky here with all of the resources that we have. And I know that there is the resource folder that will be shared. So please visit that and see what those are. And we know that the law requires insurance plans to cover mental health services the same as physical health. So it's possible that if there are some financial burdens, it may be covered under your health insurance. So if you haven't reached out for that reason, that's a really great thing to look into, and you may be supported in that way. We also know that self-care strengthens mental health. I know self-care and taking care of yourself, especially during this time, is something that I often see on social media and that everyone seems to be talking about. And it's important to realize that even though this list here is here because of the ways that it has effects on the body and mind, it's not always the same for everyone, just like those treatments that we talked about as well. So exercise may not be getting up and running a marathon, or a 5K every weekend, or going to a whatever it might be. It might be walking your dog every morning, getting out and having some connection with nature and breathing the fresh air. Also, getting good sleep is important, and that looks different for everyone too. Some people don't need as much sleep and others need a lot. So finding out what's best for you. having a healthy diet, and how you handle stress. All of those should be a priority in how we take care of our mental health and practice our self-care. And again, self-care looks different for everyone. You know, self-care is not always yoga and journaling. So finding out what makes sense for you. It could be music, it could be connecting with nature, it could be volunteering. It may be just getting up in the morning and reading the paper with a cup of coffee. So it's really dependent on what makes sense for you and what makes you feel good and what's healthy. So support for loss of suicide survivors and those with lived experience is very important. We do this in Chautauqua County in a variety of ways. Carrie Rayner also works under the Community Alliance for Suicide Prevention. She's a loss survivor herself. She has been trained through the American Foundation for Suicide Prevention in bereavement support group facilitation. And we've been partnering with the Mental Health Association on providing those groups to our community members. Currently, they are in a virtual setting, of course, due to COVID-19. But we want to make sure that that lived experience is heard, and is important that other people are hearing someone's story, but also how they find hope, and how they found healing, and how they are thriving and how they are taking care of themselves. There's also another group at the MAJ, Alternatives to Suicide, so it's for attempt survivors, and talking about just that. So we are trying to do good reach out to those that have attempted, or those who have lost someone, because we know it's such a unique loss or experience, and we want to pay good attention to that. I mentioned this a couple of times. The most important thing you can put between a suicidal person and their way of ending their life is time. Having good conversations, getting them in for professional evaluation or assessment, getting them engaged in treatment, and giving them a safe space to discuss why the pain has been so unbearable to them. And a lot of times when someone is thinking of suicide, they just want someone to acknowledge the pain that they're in. And sometimes it might be hard thing to admit that themselves. So that's why if we can pay good attention to those small behavioral and emotional changes, we can start having those important conversations that can help save lives. I'd already talked about limiting access to means which prevents suicide. So again, having those good connections with understanding, you know, when someone needs that extra support on making sure that their house is a safe space for them, and being okay to have those conversations. Some of those examples here are, you know, especially during a high period of risk, the safer the environment is, the better chance a suicidal person has of living through the crisis period. Suicide prevention research has looked at a number of ways to create safer environments. You see here, installing inexpensive carbon monoxide sensors, automatically shut off cars if carbon monoxide levels reach unsafe levels would save lives. We've also learned through research that installing barriers on bridges deters suicides, and in many cases has lowered suicide rates for those regions. Restricting access to potentially lethal medications reduces suicides, and can be as simple as requiring lethal drugs to be sold in blister-type packaging. And then firearm safety is critical to reducing suicide rates. In the US, firearms are used in roughly half of all suicides, which makes suicide prevention an important part of gun safety education. So what you can do, I'll wrap up with this. I know we have a couple of minutes left. Have that conversation. I've said this, I don't even know how many times in the talk, but be confident in having that conversation. The best way we can prevent suicide is to be comfortable in talking about suicide. We want to make sure that we're watching out for warning signs, being comfortable with reaching out, and when to know when to seek help. Warning signs can be things like some things that someone may say. It also may mean their behaviors, and their mood may be different than what you usually expect from that person. So they may say things about, they may talk about ending their life directly. Because they are more direct in their talk about suicide does not mean they are less serious. That is a common misconception and taboo. They may also talk about having no reason to live. So again, that hopelessness for the future, being a burden to others. They may feel trapped, again, in perhaps a life circumstance, and they may be in that unbearable emotional and or physical pain. These are some of the behavioral risk factors. They may increase substances to cope with some of those life circumstances that I have talked about, or mental health symptoms. They may have issues with sleep, maybe too much or too little. Acting recklessly, you know, that impulse thinking that we had talked about before, not having a lot of regard for how their actions may affect the future. Withdrawing and not replacing those activities with other enjoyable activities, or withdrawing from family and friends, looking for lethal means, and then giving away important possessions. And then here are some moods that we also need to be very alert. We've talked about depression, apathy, rage, irritability, impulsivity, humiliation, and anxiety. And of course, trust your gut. Assume that you are the only person that is going to reach out. A lot of times we take the stance of, it's not my business, someone else will do it. And we can't assume that. Just know that if you reach out, you may be the person that might have a really good connection with someone who's struggling. They may really feel connected in having this conversation with you, when others may have reached out numerous times in the past. And if you've reached out once and you're not satisfied with that conversation and you still think that person is struggling, then reach out again. How to reach out: talk to someone in private. Be genuine and listen to their story. Give them that space to talk about their struggles. Express your concern and caring. You know, I have noticed that you haven't really been coming to class, or you've been falling behind on your grades. I'm really worried about you. Can you tell me a little bit more about that? You know, ask more questions. Give that person that outlet to talk about those things. And again, asking directly, are you thinking of suicide, is important. Not dancing around the subject, saying, are you thinking of hurting yourself? Are you, of course you wouldn't want to say something like, are you thinking of doing something stupid? Because suicide is a very serious issue, and to that person it is not stupid. So we need to be very specific in the questions that we're asking, because again, that brain function may be limited at that time. And always encourage for them to seek mental health services. Of course, we want to avoid minimizing feelings. Avoid trying to convince them that life is worth living. This is the moment in which they need someone to listen to them, to care about them, and to engage in that conversation that makes them feel supported and heard. And not alone. And try to avoid advice to fix it. If you think someone may make an attempt soon, stay with them, help them secure or remove lethal means, and escort them to mental health services. I gave a couple numbers here. We'll also give you a local one in just a moment, but this is a suicide prevention lifeline. This is the national one, probably the one that you see most often marketed on social media. That is the one that is constantly shared on those statuses that they ask you to copy and paste. That is 1-800-273-TALK. And then the crisis text line as well. I always urge everyone in all of my trainings to put these in your phone, as if you will never know when you need them. And it's better to have it right on hand, because you could make a call with someone that is struggling rather than taking the time to look for it. Obviously, for emergencies, call 911 if you think if someone is an immediate risk and you cannot be supportive, or you cannot be there to support them in person, or if you're very worried about their well-being, please call 911. And we can create a culture that's smart about mental health and suicide prevention if we're open about having these important conversations, even though they may be difficult. But if you can open that door with someone, not only just about suicide, but just talking about mental health, or just talking about them in general, I think as human beings, we want to have that genuine connection. We want someone to actually listen to us and to hear us. To give some other numbers here, our Chautauqua County mental hygiene clinics, Dunkirk and Jamestown, open access hours and same-day services all are available. Same thing with telehealth. Access right now does look a little bit different during COVID-19, but all of our services are available if you call those numbers. And I also gave you the Chautauqua County Crisis Hotline number as well, and that is our after-hours crisis hotline number that can be reached at the number on the screen. I also gave a little information here. Please follow the Community Alliance for Suicide Prevention and the Chautauqua County Department of Mental Hygiene on Facebook. We post a lot of other trainings that are similar to this and other initiatives as well. My contact information is at the bottom. Same thing with Carrie if you have interest in any of the bereavement or suicide loss survivor initiatives as well. So it is 11:44. I'm not sure if we have time for questions. I see the chat is lighting up. So let's see if I can pull it up if there's anything I can maybe answer. Alex or Trish, are there any questions?
Yes, we do have a few. Alrighty. The first question is in regards to recording. And we'll say this for everybody, but then we'll also ask you specifically in regards to the availability of recordings for individual sessions that will be up to the presenter and whether or not they feel that the information can be sent as a recording. Is that something, do you know, that will be available for your session, Victoria, or would you need time to figure that out?
Sure, I would be more than willing to have this shared, absolutely. I also have a copy of this shared actually in a Zoom recording myself from other trainings that I have been doing. It's a little bit longer of a presentation, but I would be also more than happy to share that as well.
All right, fantastic, thank you. All right, so we have an anonymous question here. They wanted to clarify a statistic from earlier in your presentation. You mentioned that for every one suicide, there are 25 attempts. Is this saying that a person who has died by suicide has attempted 25 times prior to their death? Or is it saying that for every one death by suicide, there are 25 other people who attempt suicide because of the one death? I guess we were just looking for some clarification on whether that was on an individual level or what that meant.
No, you're right on the second piece there, Alex. It's for every one suicide death, 25 others attempt is what the data is showing us. It's hard to know for a particular person who has died by suicide if they've attempted in the past unless that was documented in some way.
All right, fantastic. Thank you for that answer. And we have a question here from Melissa, more of a question from a parental standpoint. How would you react to a 7-year-old who, when frustrated, shouts out, "I just want to die," or "I'll just kill myself"?
Sure. That's a common question, actually, especially in high school as well. And I know that it is becoming a more popular thing for younger kids to say. I think sometimes when youth and children and even adults are frustrated or overwhelmed, saying something like, "I just want to kill myself," or "I want to die," is that feeling in the moment. And it might not necessarily be what they mean. But I think having those important conversations about what that means to that person, you know, tell me more about why you say that. Is something frustrating you? Is something overwhelming you? I want to talk to you more about that rather than, you know, just don't say that, it's not appropriate, because we don't really know, right? So I think it's that, take that opportunity as a time where it could be scary or it could make you upset, because if it's something that your child or a student says often as a way to communicate frustrations or anger, it can be hard. But I think taking them aside and having a serious conversation about, tell me more what that means to you. You know, do you really want to die, or are you just frustrated? And if you are frustrated, I want to know more about that, and I want to know what that means to you, and we can help ways to work through some of those difficulties. And you know, I think a lot of times with young people, I'm not a young person anymore, but I think it's things can be very emotionally driven, right? Very dramatic. And I think that it's either they like something a little or they're absolutely in love with it. And I think that goes with their emotions and frustrations too. So I think it's just a good time to open up the door around having some serious conversations about why they're actually saying that.
All right, fantastic. There is one more question here, but I know that we are going to be transitioning into our Fred Talks. So I will read it out to you. And if you are available to open the question and answer window or respond via text to this person, that would be fantastic. That way we can proceed with getting things set up for our next group of presentations. The question comes from Rachel Stamen. She says, sorry if you already covered this. The descriptions of how someone may act are all common behaviors in teens. What's the best way to tell if something is wrong with a teen? So we'll have you respond with a typed answer if possible.
Sure.
Is there anything else that you would like to say, or?
I don't think so. I think I just want to leave everyone with a last thing on that one, because that is a common question, is really look for differences and just make sure that you're having those open door discussions with your teenagers. Life is hard for a teenager. They're going through a lot of difficulties. A lot of it looks like, you know, maybe it's mental health symptoms when it's really just typical adolescent development. So pay attention to patterns, pay attention to things they're saying and things they're doing, and have good conversations and being that trusted adult.
All right, thank you so much. We appreciate all of your questions, everyone. And I'm going to turn it back over to Mel, and she'll direct us from there. Thank you.
All right. Good morning, everybody. Thank you so much, Victoria, for that wonderful training and presentation so needed in Chautauqua County and throughout Western New York. So we really appreciate you taking time to share that with us today. We are going to take 11-minute break. Sorry, we were over just a little bit with answering all those questions, which is great. Keep those questions coming throughout the day. We have 11 minutes to stretch, take a break, and switch over to our Fred Talks session. So go ahead and take a little bit of time for yourself, and we'll be back on the hour at 12 o'clock. Thank you.